Hi. Good morning.
We are so glad you're here.
Thank you. I'm glad to be here.
For joining us, and I know your message will be a blessing to many.
Yes. Well, thank you for having me, everyone. First of all, good morning. And thank you for the rise and shine coming here. See, the sun is coming out. Really nice. When June had asked, for me to come and talk, I was like, oh, I was a little nervous. And I'm like, oh, I don't know. I was asking my boss because she's so great at public speaking and so on. But, they told me, they're like, Jody, just try. But not only that, one of the members of this church, her granddaughter works with our life program. So yes, she came up to me. She's like, hey, Jody, are you doing a presentation at St. John's Church? I was like, I am on Saturday morning. She said, oh, my grandma goes there. And I was like, oh, how cute. I was like, great. I was like, I hope to see her there. So I don't know if Sadie's grandma is here this morning.
No, she isn't.
No?
It's Becky Overton. Oh,
Oh, okay.
Is here. So she leads our sewing and knitting group.
Oh my God.
Well, Loretta's grandmother works there.
Huh?
Loretta's grandmother works with this program, I think. Loretta Westfield.
Elizabeth Becky Overton.
No.
Yeah, but Loretta told me their granddaughter works there.
Oh.
Oh,
We're going to
wonder-
have to find that out.
I know. I want to see who's Loretta's granddaughter.
Loretta is one of the people who goes, who's in the program.
Oh, she's a participant.
Yes. And
Oh, Loretta. I'm pretty sure if I look her up to see who's Loretta, because we have so many wonderful people that go there. They're so cute. So today I wanted to talk about our LIFE program, and LIFE stands for Living Independently for Elders, because I feel that no one should leave their home, especially the comfort of their home, to go into some type of nursing home or assisted living. I'm sorry, that's not the most comfortable or a place people want to be at, But our services provides all the services you would get and even more if you were at an assisted living or nursing home. See, so you get all the care while still living in the community, while staying fit at home. So that's our whole motto, is to keep you in place, and out of hospitals as well. So today, what the LIFE consists of is an IDT team, which is all these little pictures you see here. IDT stands for Interdisciplinary Team, which consists of, a primary care physician, which is actually a gerontologist, because I feel like after a certain age, you should start seeing a gerontologist because, they're the people that went and for advanced training in the aging of a person. So they will be the ones that will notice like early stages of Alzheimer's, early stages of dementia, Parkinson's. They could see that in the heart. And guess what? We could start treating it early to try to, keep it. So also, you will have a dietitian. And the dietitian, we just feel is important because a lot of people have diabetes, high blood pressure, high cholesterol. So what they do is they sit down with you. They'll come up with a meal because some people are allergic to certain foods, and things like that. So they sit down and they'll come up with a meal plan for you. And then hopefully that'll work. And then also, we have social workers, which, I love the social workers. They're your advocates. They're the ones, I call them the enforcers. They're the ones that you make sure you're getting the best care. And what do I mean by the best care? Well, for example, our whole motto is to keep you well, right? And keep you out of hospitalizations. So let's say you call your social worker, right? When they say, hey, I'm having shortness of breath, I'm not feeling well, so on and so forth. The social worker will go to your nurse and she'll say, hey, Mrs. Such and such doesn't feel well. I was like, can you please go check on her? So the nurse will come out to your house, check on you. If she feels like you're okay, so you could come in the next day and see your doctor, then okay. Or if she feels you're not well enough, then she will call an ambulance, and have them take you to one of our hospitals. So I want to say maybe last year sometime, one of the patients, called, And the doctor gave her a referral to go see a cardiologist. Well, when she went to the cardiologist, all they did was just hear her heart with the stethoscope, and didn't do like an EKG, did not do an echo, anything, no deep, thorough assessment. So after the appointment, her social worker calls her, asks her, hey, how was the appointment? We didn't see any records, any x-rays, So she's like, oh, I don't feel like they did, a thorough enough job. They're like, hold on. We just sent for you to get an EKG and check you out and things of that nature, and they did not. She was like, no. So she called the cardiologist's office and put in a grievance, against them, because our whole motto, let's say she did have a problem with her heart, right? I was like, well, how do we know if you didn't check it? Because if she did have something, then you know what? We could have prevented it. Because if she would have got a heart attack that night and ended up in the hospital, we have to answer to the state and to the feds. Yes, exactly. Also, if you're spiritual, we do have a, like religious person out there. You don't have to be Catholic. They do welcome every religion with open arms, or non-denominations, Also, let me tell you about Day Center. That's the highlight. At our Day Center, we do provide transportation to and from your home or wherever you're living with or where you live at. And they do not expect you to be outside or anything. They go straight to your door. They'll knock. If you need a wheelchair, they provide a wheelchair. And they bring you to the center. Now, at the center, they have a lot of things going on. So let's say on warm days, summer, they take you out to like Charlie's Boathouse. They'll take you to Botanical Gardens. Sometimes they take the ladies to the nail salon, get their nails done. They also have all these events going at the center. Like sometimes we have like these small petting zoos that come in. We have like singers that come in, people that play the piano. We have people that paint, like painters, and they come and they can splash. I mean, it's so many things that's always going on there. Yes?
Where are the day centers located?
So we have 3 of them. There's one located in OLV Senior Center, that neighborhood, the OLV Senior neighborhood, like across the street from the Basilica. And then the second one, it's located on the Villa Maria campus in Cheektowaga. And we just opened a 3rd one on the west side / downtown at the Duville campus. So we do have 3. You're welcome. Also, we also provide aid service or CD positive. You have someone that could take care of you, a family member or a friend that you're comfortable with, we will pay them and they could, give you any services. Or if they already work for maybe like a home health company or something, or agency, maybe we could pay the agency so they could continue your services so it won't get interrupted, because we do know how hard it is to come around good aids. So also our transportation, we do provide transportation not only to and from the day center, but to and from all your medical appointments as well. And then again, as I mentioned earlier, you will have an assigned registered nurse. And this nurse, like I said, we have physicians and nurses available 24 hours a day, 7 days a week. It doesn't matter if it's a weekend or holiday, someone is always on call. And also, you know how sometimes people have a stroke, aneurysm or something, and you get that left hemiplasia? So you need therapy to learn how to talk again, walk again. They have occupational therapy as well. And besides all that, we do provide, we bring your medications to your home, because we have our own pharmacy. Also, if you need help setting up your medications, because sometimes people have those little pill little dispensaries, and they like to get them pre-filled sometimes, because sometimes people forget if they took them or if they didn't. Also, we provide, let's say you have your own home, for instance, and your health took a turn for the worst, we install ramps. You know, where if you become wheelchair bound, we install ramps for you. Let's say you live in a home or somewhere that you don't have an AC unit, but you have asthma or COPD or anything like, lung problems. We can install also an AC unit for you as well. I mean, hospital beds, chug pads, depends. If you need a recliner, like a lift recliner, a Hoyer lift, I mean, you name it, like we do everything. Now, everybody's like, wait, so how do we get paid, right? So, how do we get paid is by Medicare and Medicaid. Medicare and Medicaid. Or if you don't have Medicaid, there is something that's called private pay, that you could pay the portion of the Medicaid part, which is a little steep. It's about like $6,600 a month. Exactly. But some people, they don't know that they can qualify for Medicaid. And how? You're probably thinking like, what? So, right here, so everybody can understand.
You want me to test this out for you?
Sure. So there are different ways to get Medicaid. I know some people will be like, oh, but I don't qualify, or this, or that. So unless your home is worth more than 1.1 million, you're allowed to have your home. Yes. It doesn't matter. You're allowed to have a one car as well. It doesn't matter if it's a Rolls Royce, a Corvette, but as long as it's just the one car. Then it goes into like, there's something called pool trust. Has anyone ever heard of a pool trust? No? Okay. I'll talk about that as well. I'm sorry. No, I just wanted to see what everyone, knows, doesn't know. Pooled. P-O-L-O, I'm sorry, P-O-O-L-E-D, pooled trust. Uh-huh. So with the Medicaid, as long as you don't have like over for a single person, let's say you can't have more than like 32,000 in the bank, not retirement, but like savings. And so if you don't have more than 32,000 in your savings account, because you are allowed to get the minimum distribution of they don't count that against you, your retirement. They do not count that against you. But in this case, like the Medicaid income resource limit, it's $1,800 a month. So what that means is, let's say you receive Social Security, right, and your pension. So let's say, just to throw out a number out there, let's say you receive $2,000 a month, right? So the difference between the $2,000 and the $1,800 is $200. So there's a Medicaid thing called Medicaid spend down. So you will pay the difference monthly, that those $200, you will open a pool trust, put those $200 in there, right? And then you could be able to get all the Medicaid benefits. Now, I do not recommend people to use those $200 in that pool trust as a savings, because if something, let's say it does grow because, you left the $200 there. If something was to happen to you, the state will keep that money. But those $200 in there, you could tell the state, that pool trust, that you want it towards, it could be your insurance, it could be maybe towards, rent, mortgage, and, your, a light bill, a gas bill, property taxes, anything. So just for opening that pool trust and putting those $200 there, you could benefit. You get the best of both worlds, because you could still use your $200. It's just because you opened that pool trust and because your doctor deemed you disabled, because first you have to be deemed disabled. So like, let's say and disability could be anything. You could have arthritis, you could have, something that it disables you from doing what you used to do. Like, some people can't cook no more or wash dishes, get down, clean your bathtub. Yes, ma'am.
On this pool trust, is there any time restraints on the money has to be in there for?
Yeah, it's monthly.
60 days or,
No. So monthly, you just have to deposit those $200 in there. It's a monthly thing. So maybe it's every 30 days? Every 30 days. I would say just to, I don't know.
Every month you have to keep putting $200.
Yes. And that's why, I'm sorry, yes, and you don't withdraw. You have to tell the state where to send that money to.
where to send it?
Yeah, you have to tell the pool trust where to send the money to. So whether, like I said, it could be towards your mortgage, towards your taxes, towards your insurance, grocery, whatever. Because let's say you use your credit card for your groceries, then they could pay your credit card for your groceries.
It's got to be to a destination. It can't be sent back to you.
No, exactly. It's not sent back to you, but it's sent to wherever you have designated those $200 to get deposited into.
So it's paying bills. It's paying your bills.
Yes. So it's not like you're losing those $200, you still are able to use it. But just because you open that pool trust, Medicaid, now you're eligible for the Medicaid. And even though, so that $200 is called a spend down, which is called a Medicaid spend down. Because a lot of people do receive a little bit, over $1,800 a month.
You need an attorney to set up a pool trust.
Well, over here, if you turn, like I'm sorry, there's people right here. You could go to elder law attorney and they could help you. But right here, there's like things that you could call and they could help you with this. And if you need, I have something called senior benefits list that also helps you. Like there's services in Erie County that they could help you with this. Or if you need help like that, we work with Western New York Independent Living, who could come out to your house and help you with the Medicaid process as well, or the pool of trust.
You can't take it and send it to Wegmans for food or anything else.
No. So let's say you use your credit card and buy the food. Yes. So let's say you go grocery. I think so, yeah. Card payment, insurance. Yeah, because so let's say you use, sometimes, like me, I like the points. So I travel and everything, so I use my Capital One Venture card, because sometimes they give me 10 points for this, 12 times the point. So I get to put it on my card and then, it's okay. And get, to pay it off. So it's the same thing. You could put it on your card and then tell them, like, hey, I need this grocery bill. No, it's a good program.
I was busy reading, you said about contacting someone, about coming
Yeah.
to your home and talking?
Yeah, so I could give you, right here, this is also, here you go, I'll take one. So we have people that do come out to the house. Like I said, somebody from Western New York Independent Living, and they could sit there and talk to you and help you with setting everything up. They could tell you how to go about it. Like, hey, I'm interested in this, or see if I qualify for Medicaid, or what are my steps. I think I need to open a pool trust, and they will help you with all those steps.
Okay, thank you.
What is your capacity? How many people can you handle at a time
Well,
in a week? It seems like you offer so many different services.
we do, but
And you've got to have a humongous staff and a lot of vehicles to be moving all these people around. How many people can you facilitate in this operation?
So right now we are serving 253 people, but not everyone goes to the day center. Some people, they just like bed bound. Some people, we have vans, and like I said, each site, we have our own staff teams on each site. So we have doctors at Duville, doctors at OLV, doctors at Villa. So everybody, like, for example, Duville just opened, we only have 5 people right now. And it's like, so right now we just have the one driver. So as it grows, our staff grow as well.
Excuse me. As far as locations, since you're willing to pick people up and bring them, is there a distance limit? In other words, say it was the OLV center, that's how.
Well, I mean, we try to, so we don't want anyone, to sit for so long, in a wheelchair or in a van, So we try to get them to whatever closest facility they live by.
I guess she's at, how far a radius do you go out? to get-
Oh, we go to Grand Island, Springville, Alden,
Have
Helma.
to be in Erie County.
Yeah, it's just anywhere Erie County.
How does one qualify? The one woman from our congregation, who's 96 now, said she didn't qualify last year because she wasn't sick enough. And so, how does one become eligible?
Okay, so one, you have to be 55 and older. 2, Erie County resident. 3, Medicaid and Medicare. But like I said, there's ways around things. And you also need help with your ADLs, your activity daily living. So in other words, you might need help bathing, transferring, showering, toileting, cleaning, laundry, finance, cooking. It's a whole bunch. Let me see, I tell you right now. So usually we'll go to the homes and bring enough, and I will ask these questions. Just a basic eligibility. So they ask you, like if you need help with bathing, grooming, eating. When I say eating, sometimes, because of the arthritis, you can't cut the food, right? So some people need to set it up for you before you start eating. Dressing, sometimes you can't reach socks, your shoes, your coat, transfers, like from maybe you need help from your wheelchair to the bed or toileting. Right, yeah. Walking, like if you need help, like if you use a device to help you walk, or maybe for wheel walker, maybe a cane, or something. And then they ask you if you could do stairs. Can you go up and down stairs? Some people can't because their knees, or, something, the arthritis is not letting them. And then, they, like I mentioned earlier about you need help setting your medications, you need help cooking, shopping, any housekeeping, laundry, if you need help with your finances, do you know how to use a telephone? So top of that, we give people gram pads, that they, with the bigger letters and numbers, and you could, video your family, friends, call, and we also give out like those purrs, the necklaces, like, and or the bracelet, or we had those air ones that you could, they put it on you, like they stick it on your shoe, and usually those are for the people that have like advanced Alzheimer's or dementia, that we call them the runners, that they leave and then they get lost and we can't find them and things of that nature. So we have a lot of area. And so yeah, pretty much. Now on top of that, we also pay for dentures, hearing aids, glasses. So I do know, like, there was some people's like, hey, I have, United Healthcare, but, they gave me the hearing aids. It was like, but one of them broke. They wasn't able to fix it, and they said I have to wait 2 years for the other one. I'm like, no. So in our program, we do not believe that you should have bad hearing for the next 2 years. Like that's not fair to us. If something breaks, and let's say we just received it, like maybe a month or two, it's not fixed. We can't fix it. We just got you another one. It's just like that. Yeah. So, any more questions?
You do accept folks with dementia and Alzheimer's?
Yes. We have a lot. This is the geriatric population, so we know as you age. We know what everything comes with. So that's why I was saying not everyone goes to the day center. We do encourage it, for socialization, because a lot of people are depressed, they don't have family, friends, at a certain age, everybody starts dying off. But so like I said, we do offer a lot. Not only that, but there's a podiatrist that comes in monthly, cuts your fingernails, your toenails. We also have a stylist and a barber that comes in monthly, grooms people's, hair, and, they cut them. So it's a lot. And then another thing, let's say you wanted to take a shower or bath, but you couldn't because, some people have, like dizzy spells or things, or they just afraid they might fall, slip. Over there, we have showers, we have jet tubs, where usually with the jet tubs, we put the people in there that have like plantar fasciitis, edema, cellulitis on their legs, poor circulation, so that helps with the circulation and things like that. And we give them, like I said, or sometimes, like, let's say they live with children or something, so the children didn't have a chance to give them a bath, before going to the center. So they'll call us like, hey, can you give them a bath because I didn't have the chance? Of course we can. We also offer respite programs twice a month, 2 Saturdays out the month, which is like the first Saturday and the third Saturday, which is from 10 to 3. So people could go out and run their errands and shopping, things of that nature as well. Well, oh, okay. Yes, sir.
We have two of the folks I visited that are in the program over the last 6 months. They can't say enough good things about it.
Aww.
But my understanding is that when you go into the program, basically the program takes over case management completely for the individual.
Yes.
So they become the primary, they become the ones that refer to other auxiliary doctors. They manage therapy, they manage, so everything.
So it's a PACE program.
As you said, pharmacy,
Yes,
all that stuff.
everything.
So instead of having to go to 16 different doctors,
Exactly.
they go there and everything, and that's one of the things that seems to me to be pretty appealing.
Yeah, and like I said, Catholic Health, we have hospitals and clinics all over Erie County. We have Sisters, St. Joe's, St. Vincent, we got Kenmore Mercy, South Mercy, we have the Max Center, the Trinities, we have so many. We have over 750 providers and contractors. So another thing, let's say somebody's getting cancer treatment in Roswell Park, just let's suppose, right? And so Roswell Park does not have a contract with us, but they do individual contracts, which, we believe is a great thing because we wouldn't want anyone to get their chemo or immunotherapy, interrupted. So we will pay Roswell so they could continue, your chemotherapies. Yes, ma'am.
One more question. What's interesting about Medicaid, supposing you have a couple who have more resources, and like I said, we're retired, we use an Advantage plan. Say we had everything in place we have now, but we were disabled.
Uh-huh.
We would drop our Advantage plan.
Right.
We would have to get Medicare A and B, I trust, and D, A, B, and D for drugs. I would have to buy that, right?
Well,
Assign it to you folks, or how does that work?
okay.
You pay, out of your checks, so how does that literally work? If I were to, which I don't plan on.
No, right, no. Yeah, because these are for people that are in need. But, so some people are over-resourced, right? And, like I said, that goes, up to you. So a lot of people will tell them, hey, if you have this much money in the bank, let's say over-resourced, try to spend it down, meaning put it into your house, remodel or do something just so, could kind of go down and stuff because that's another thing. We don't have a look back. If you want to go to a nursing home or assisted living, they have that look back of 5 years. We do not have that as of yet.
So you definitely want someone who has Medicare, Medicaid situation, that's what you're
Yes.
That's your best client.
Right. Or you could do the private pay. You know, so like I said.
What is private pay?
Well, private,
That's strictly the private pay, so it's either Medicare,
Mm-hmm.
Medicaid, or private pay.
yeah, or if you don't have Medicare yet, because some people, you know, it's from 55 and over, the Medicaid will pay the Medicare part.
Okay.
So, but, yeah, I'm sorry, what was your question?
If you only have Medicare,
Uh-huh.
you don't qualify for Medicare.
Okay, so that will be private pay. So, because you'll be paying the capitated rate of Medicaid, which is $6,600 a month. You're welcome.
That's where really, if you're in a well situation, probably consulting with an elder care attorney is the thing. I mean, that's what
Right.
I've been doing, frankly.
Yes. And also,
And she's helping me set up my accounts in ways that would make it, you know, that I'd be more able then to move into a Medicaid situation if I had to.
right. But there's also something, because sometimes, let's say, like, I'm not sure, but let's say like you both, you guys are a couple, right? Let's say maybe you didn't work, you know what I'm saying? But your husband did. This thing is called spousal impoverishment, and there's something called spousal refusal. So they only will look at the one side. So let's say they will only look at your income, which you probably won't be getting any income because you was living, you know, off the husband. So then they'll go by that, and you know, as a single person, will qualify.
So basically, instead of having a house in both names, you put a house in one name. If you have investments, they all get put under the healthy spouse's name, and then they look only upon the ill spouse. or
Yes.
disabled
Or the poor spouse.
spouse. No, sorry, you don't have it there.
Let's go.
Just curious.
Yeah.
People will ask.
No, of course, yes. That's why I'm here, to answer any questions you guys have.
Jody, could you tell me again your respite program? Is it what Saturdays again?
So it's the first and third Saturday of each month. And that's at our Villa Maria campus location. That's where they offer it. Yes. And it's free, excuse me, and it's free. Even if you're not in our program, they offer it free for the community.
My better half is smarter than I am. Okay? About this kind of stuff.
Okay.
Because she'll expect me to come home and tell her everything.
Okay.
That's one of the reasons why I'm doing this.
Sounds
But
good.
anyway, long story short, do you make house calls to explain the program? Like if you
Yes,
wanted to?
yes, like if they were interested, let's say you want to hear it one more time or something, you could call us. And like my team, because it's me, I'm the outreach coordinator, so I'm always out doing the presentations, and I also do blood pressure clinics. It's like, but we have, like my boss, her name is Karen Schalke, and she'll be more than happy to explain. I mean, she's a guru in this, and she could go into more depth about it. But then we also have like Annie and Nick, which is our intake and enrollment team as well. I mean, it's just like the four of us in that one little department.
You have a card there too, right?
Yes, oh yeah, we have cards and everything. So Karen, yes, you could call Karen, because I say Karen because I'm always out in the community. So sometimes I tell people, I was like, you know, I'm sorry if I didn't pick up. But here, yes, Karen could, if you want to pass it down. I'm sorry. Oh, here you go. Want to pass it down? Respite care is free. Our respite care is free. You don't have to be in our program to be in the respite care.
I mean, length of time, is it 3 hours or 4 hours?
It's from 10 to 3. And they do offer lunch, and they pick you up and drop you off. Like some people at our day center, some of their like children or their spouse, they drop them off instead of having the van, you know, come pick them up. And so whatever, you know, it's convenient for them. Because, you know, I mean, it helps a lot of the caretakers. Because you know how many people call us crying because, you know, they're like, they don't want to put their parents in a nursing home, but they're so overwhelmed because between their jobs, their children, you know, they're married, you know, they have to take care. So we try to just take off that burden just a little off their shoulders.
Through the Alzheimer's Association.
Really? Oh my God, that is so nice.
Tuesday.
Also, you guys, oh yes, you did mention that you guys have respite also here. That's so nice. I mean, it helps. It helps everyone. You know, I'm like, I mean, when I tell you that I have people calling, crying, I feel so bad. They're like, I don't know what else to do. I don't want to put my mom, or dad in a nursing home, or they don't want to do this. They're set in their ways, or, and like I said, I'm like, well, we can't force anyone to be in a program. I say, I will be more than happy to go out and try to, not me or anyone in the team. I say, and talk to them and try to convince. I say, but we cannot make someone. And the good thing about our program also is that, let's say you join. You're there a month, 2, and you don't like it. You're like, oh, this is really not for me. You could disenroll. This is not where you have to say like a year or 2 and like, oh my God, what I got myself into. No. You could disenroll if you're not happy with our services or our program.
People with long-term health care insurance, can that be used for this?
Yes. So we're all about, like right here, like the MLTC, which is, you say managed long-term care, or community-based long-term care. Those are the Medicaids because some people, they do have the Medicaid, but they don't have the long-term care Medicaid. So it's called an upgrade. We will upgrade their Medicaid.
I have long-term care insurance, so
Okay.
how would that be used, if at all?
So that's the thing. If you join our program, whatever insurance you currently have, that's the middleman. We do not need that. Yeah, because a PACE program, life is a PACE program. There's only 2 PACE programs in Erie County. It's with Fallon Health and then with the LIFE program. So PACE stands for Program of All-Inclusive Care for the Elder.
So if you look underneath it's in fine print on the front of the pamphlet. She's referring to the PACE program. It's here, it's in white at the very bottom. And that's Program of All-Inclusive Care for the Elderly, is what she's
So
referring
the
to.
services are paid through your Medicaid,
And Medicare.
so you don't have to pay anything.
No, you won't
But
have.
you have to be financially eligible for it.
Yeah. But I mean, like I said, there's ways around things. I mean, a lot of ways he just said that they're helping him so he could get to Medicare level. And like I said, these people, like the Western New York Independent Living, they will sit there, help you, or an elder law attorney as well. Like I said, on the benefit checklist, there's people on there as well. And also, like for the pool trust, I believe they have something there as well. I mean, they have so many services that a lot of people don't know that there is, like, I think, someone just asked me, like, how long, I think it was June, how long this program's been around.
Yeah, I was flabbergasted.
Since
First question I asked Jody when she came in this morning was, how long has the program been? And then she said,
2009. Since 2009.
Isn't that something?
yeah.
Okay? Now, it all started back in California, back in the 1970s. What it was like these foreigners had came, they're working, whatever, but their parents started getting ill. So people was like, oh, you could put them in a nursing home. While they're like, oh, no, hold on. We don't believe in nursing homes. So you have to come up with something. So that's how the PACE program started. So it started doing so well in California, it started trickling down to the states. And not every single state has a PACE program. Not every single state. Maybe 30 states or 20-something states have the PACE program. But not all states do have a PACE program. But it started back then with a set of immigrants that didn't want to put their parents in a nursing home. They're like, we have to come up with something better. So this is how PACE program started, which I think is a wonderful program.
It's a good model.
Yeah, great model of care.
Does it matter if you're out of New York City for several months a year, like going to Florida in the winter? Does that affect, or you have to be here?
I mean, if you wanna use our services, yeah, our services are only here.
No, you can't go there.
Right.
Or you could leave and.
Yeah, because I know, some people, they have their Florida home, so they go, to Florida to keep warm, and then come back, in the spring through fall. So I wouldn't see why not. You don't have to go to the day center. Like I said, we just encourage it if you wanted to go. But yeah, I mean, if you want to live there and then come here, I don't see a problem.
If they did go to Florida,
Uh-huh. Because I don't know how your insurance works over there. Because see, here, so in other words, if you was in Florida and something was to have happened, that I would have to, Karen knows a little bit more about that, because yes, you would, get services and things like that, but it's like, I'm not sure how that works exactly, because I know they do pay like for because if something was to happen to you, you have to go get medical care.
The insurance I have here would not.
No, but I know that they will pay for something or something. I'm not sure, but I remember, no, it's a great question. I'm not sure, but that's something like more like a Karen will be able to answer. But I know that yes, they do pay some. I just don't know exactly how that works, because one of our neighbors were, one of the children took them, and I don't know if it was Florida or it was in North Carolina. I forgot what it was. And, it ended up in the hospital, and, they called us really quick, and the good thing is, like, we sent all the medical records just so you could get the proper care, and things like that, or instead of doing all these unnecessary tests to see what's wrong with you and things of that nature. But I know there was something I couldn't, because like I said, I'm not in the office long enough every day for me to like find out about everyone. But I remember like something, but I just don't know what it was. But I know it's something about the care and something about pain, but I don't know about that department. But like I said, I'm pretty sure if you was to call Karen, she could explain that to you way better, because she is the guru. She's been doing this for 16 years.
Good question.
Yes, sir.
If you wanted to sign up for the program,
Mm-hmm.
let's say you didn't want to use the services outside, where you go and exercise or do the outside activities, can you choose A, not to do that, and B, does it lessen any of your monthly expense if you're private pay? You still pay the $6,600 regardless.
Yes.
But can you choose not to opt to use the outside service, where you go, let's say, to a daycare center or something?
Yeah, we just encourage it. You don't have to use, like, not everybody use all the services. Not everybody needs it, and not everybody wants it. It's like, we also offer like Meals on Wheels or Mom's Meals as well, and we pay for that as well. So you would never have co-pays, you will never have deductibles, you will never have prior authorizations, because sometimes insurances don't want to pay. For example, there's a person, right? Diabetes. Their insurance, they didn't want to pay for the podiatry, which that goes hand in hand. I'm like, now why don't they? And what happens? United Healthcare, Humana, Fidelis, all of them, they started giving this card, this little benefit card to people, which has like maybe $200, $150. I said, because they're doing that, so they stop paying for this drug, these services, and everything. But guess what? At least you're getting this much, And yes, true, you could pay your light bill with it. You could pay your gas bill with it, internet, cable, do groceries, over-the-counter things. And that's true. But they not giving you the services you need any longer. But yes, exactly. So that's why I tell a lot of people, like, I come, like, especially in the underserved communities, like, I hit a wall with them. They'll sit there and tell me, like, how they're not getting these services, and they have to wait 3 months to see, a specialist and so on and so. I was like, oh, no, we do not do that. You're going to see somebody within 1 or 3 days. We're not waiting a month, 2 or 3 months. I'm sorry, but something could happen to you within that waiting period, especially at your age. I'm like, no, nobody should be waiting to go see a specialist that long. I mean, I find that very ridiculous. I'm like, you're in pain, and I mean, you need help now, not 3 months. 3 months, it's too long to wait.
Can you keep your same doctors that you have now?
No.
No?
Unless they're like Catholic health doctors, but your primary doctor will have to be our doctor, our gerontologist.
But if you're seeing
Well, if they have a contract with Catholic Health. And some people don't even know that they're seeing doctors from Catholic Health. They'll be like, oh, I go to Dent. I was like, oh, we have a contract with Dent. You know, a lot of people just don't know, because like I said, we have over 750 providers, including contracts.
It
Anything
doesn't
else?
include Roswell, though.
It does.
It does?
Well, Roswell is not contracted, but we do individual contracts with them, so they could continue your services. Yes, ma'am.
What if you need Roswell's service after you've already started with your,
We will pay Roswell so as an individual contract for you to continue your services. And that's what's part of our contract. So Roswell is not, they're not a contract, they're not in contract with us like Dent, but they do individual contracts. So let's say even if you started the services after you started with us and that's where you prefer to go, that's okay. We do individual contracts with Roswell Park. We don't want anyone to get, their services interrupted.
But that's only if you're already seeing them.
If you're already seeing them, or if you decide you want to go there
Oh, you
after.
can do that.
Yes, because we have individual contracts.
Okay.
Yep.
Almost sounds too good to be true, really.
I know. I said the same thing, but you know what? We have a couple people here that can say something. Oh, I mean, I don't know if they're willing enough to say, but yeah, no, I know.
Do you have volunteers? Huh? Do you have volunteers?
We have volunteers. We do have volunteers. And depending where, but we have volunteers. Yeah, most definitely.
With Alzheimer's, that's a big problem for a lot of people.
Mm-hmm.
What level can you take people with Alzheimer's?
We have advanced Alzheimer's, advanced dementia people, so sometimes, the good thing about this team is especially in the day center, everybody usually the aides and everyone that works there, the events coordinator and everyone the nurses, they see them almost every day. So sometimes they'll be like, hey, this one's getting a little too feisty, because dementia and the Alzheimer's, they get a little feisty. They get too feisty so we already know that probably their medication is not working, properly. So then we'll either change the medication up a dose, lower a dose, or see, because sometimes, then we'll see them that they're tired and always sleeping. So we'll make sure we'll ask the family, hey, are they getting proper sleep? Are they staying up? Because some people do have sundowners, and they're up all night. And then they're sleeping during the day because they're tired. So we just try to find out because we don't want to change meds or something if it's something that, like I said, they probably didn't sleep enough or something. So we deal with a lot, yeah. And we have people that have to constantly walk. So we have everyone, so let's say we have 20 people that's working, maybe one of us are always walking. Like this one lady called Marilyn, she always wants to walk. I mean, she must be so fit. She takes at least 10,000 steps a day. At least 10,000 steps a day. But that's all right, so we do, it's okay. If they're a little aggressive or we deal with them, yeah. Oh, I mean, we take care. And then our promise is to take care of you until passing. And if you don't have any funeral arrangements, if you don't have a plot or anything, our social workers will sit there and help you with that as well. Yes, ma'am. Sure, no, all questions.
Using your services.
Yes.
here, they get to the point where they really do need to enter a nursing home.
Mm-hmm.
Do you folks assist in that?
Yeah, we have nursing homes. We have nursing homes. So we will put you in one of our nursing homes, but we won't turn your care over to the nursing home. Your doctor will still see you until the end.
Just your residents, basically, it's all this, very good, thank you.
You're welcome. Yes.
Do you also deal with hospice?
Yes, we have hospice as well. Yep, we have hospice programs that if you want them, we could either set it up at your home, or put you in one of our hospice. Yep, we have it. And again, the doctor would not turn you over to the hospital. facility. She will take care of you, or he take care of you until, you're passing. That's our promise.
Do you deal with all nursing homes or just certain nursing homes?
Our nursing homes, not all, no.
You have your own nursing home?
Yes, we do. Yeah, Catholic Health.
Oh, I didn't know OLB had nursing home.
Yes.
I would assume assisted living if you really need assisted living.
We do, okay, so we,
The programs keep running that, but
right. Right, so we do have a couple contracts with a few assisted living places. And I think it's Bristol Village is one of them. I think the Courtyards in Hamburg, and I believe Mary Agnes Manor, and I'm not sure what other ones. I mean, like I said, but we do have, yes. And you can still get services. I know, everybody's looking at me like, wait, that is too good to be true, but honestly, this is what we do.
do they have single rooms or do they have to share?
That I don't know. But we could ask Karen. Because like I said, I do more of the presentations, like answer these questions, but the actual places, at those places, I really don't know. They could have a room, or I believe they would. They do? Okay. Yeah, I'm not too familiar. But you know what? No, I mean, I'm sorry. The places that I have gone, like Bristol Village, like the people that we do have there, they do have their own rooms. And there are a couple people in Courtyards, they do have, because I'm sorry, I went there, so I'm taking it that they are private rooms. Because the people that I have gone to, every person that I have seen, at these places, they do have their own room. Very nice, too. Anything else?
Any other questions that we might have for Jody? It sounds like she's given us a good contact with
Yes.
Karen. If we have any further questions, anything else that we might be able to?
But anything, like I said, you guys have any questions that you have from this literature, please call. It's like, 'cause we want you to stay out of doubt. And to see that this is a good program that might be for, and maybe, like right now, you all seem high maintenance, high functioning, I see you walking, I see you smiling, talking, no one has complained that their back or anything is hurting or that their hands hurt. So, like I said, you just need help with your ADLs, most definitely.
You might not want to show this to your children, though.
It's like, yeah, hey, I don't need to go to a nursing home. We have a program where I can stay here.
They'll have me enrolled.
Oh my God, these kids are so bad. No, but what I do like about this program is that they do not have a look back. That's what I like. Yeah, because I mean, poor people. They're like, but why? But because some people, they try to give some money to the grandkids and to the, and then, you can't do that. Oh, why did you? So we don't do that right now. And thank God, for right now, because things could change. We don't know. We don't want to stay in the feds. I mean, things could change, unfortunately. But one thing I do know is that it took an act of Congress to get this program in and established. So it's going to take an act of Congress to get rid of it. Yeah. I know. Yeah, but I know, I'm sorry. I went on and on. But like I said, please, there is no dumb questions. I want you guys to be, and like I said, if you need more information, because Karen, she could sit there, especially like anything about the pool trust and about the monies, and she will sit there and like go detail in detail, like down, like if you do this, but if you have that, but if you do this, if you put it on that, you could have this. She'll help you. She'll help you. Most definitely.
So she's
Yes,
the
sir.
one to contact to visit, or have her visit one of the.
Oh, she can visit, or anybody else from my team could visit. But Karen is the one, I will tell you. She helped open the program here. So when I tell you she's a guru, she couldn't, because Karen, she also has physical disabilities, and she's a caretaker of her husband. And she lives in North Tonawanda. So, you know, it was kind of, because, you know, she likes to also every once in a while come and
She's
say,
from Terry County and she lives in Niagara County. Unusual.
All righty, so if we are having no further questions, I just want our Christian Caring Support Group just to hang for a couple of minutes. The others, you're more than happy. There's some cider and muffins over there if you want to take one for the road. But I think we should thank Jody so much for coming in.
oh, thank you. Thank you.